Ms. Denise Phua.
So I stand in support of the direction set in the White Paper on Healthier SG. This plan is a strategic move to transform Singapore's healthcare system from one that primarily cares for the sick to one that proactively prevents sickness. Preventive healthcare aims to prevent illnesses, detect specific conditions early, and encourage the promotion of good health. Regular health screens, testing, and healthy lifestyle counseling are but common features. Now, globally, the incorporation of preventive healthcare in national plans is not new. The United States, for instance, publishes 10-year Healthy People Master Plans, 5 iterations now, to identify public health priorities to improve wealth and well-being of the Americans. The latest is the Healthy People 2030 plan. But well-written plans may be, many people in the world, including the US, are still affected by poor health. For the Healthier SG vision to come to pass successfully, we need to get the planning assumptions, strategies, and execution right. I have several concerns to which I seek a ministry's consideration and responses. Now, first, on mobilizing a network of family doctors. So, the first of the 5 key features of the Healthier SG plan is to mobilize a network of family doctors. Linchpin, as the minister has just mentioned, has called. The family doctor will consult, will develop a health plan, will conduct annual check-ins, and help residents achieve their health goals. This, in theory, sounds good. But in practice, most residents only see a GP when they are ill. If GPs are the first to be tapped upon, then their transition from the role of a GP, just addressing someone's immediate need, chop, chop, and go, to that of a family doctor or physician, this transition, this journey cannot be underestimated. How does the ministry facilitate the transition, example, of a GP who sees, say, 50 to 60 patients a day, a popular one, to morph to one that is more consultative, holistic, and takes a lot more time? Would there be prerequisite skill sets and dispositions that need to be considered? Other than their intrinsic motivation to want to do good for their residents, would a financial incentive that Minister spoke about be sufficient to cover their time and their cost? Now, many Singaporeans also visit polyclinic doctors as their first port of call. Working Singaporeans also tend to consult their employer's panel of doctors. How do these doctors become one's family doctor if they may not be the same doctor who a regular attends to one? These questions need to be answered and looked into. The devil is always in the details. Next, on developing individual health plans. Now, developing health plans for enrolled residents is one thing, but following up to ensure outcomes is another. The white paper correctly states, I quote, while doctors can prescribe activities, it will only work if residents take personal ownership of their health and their lifestyles and follow through with their health plans. The same challenges were also voiced by residents in the white paper. Quotes were given and validated also by many of our own lived experiences. The move to take personal ownership for one's own health is far more complicated than just developing a health plan. There are many theories of behavioral changes from time immemorial. If not thought through carefully, the Healthier SG vision would really remain just a pipe dream. What could be a highly effective combination of inside-out or intrinsic and outside-in extrinsic intervention measures to address the needed change in mindsets and behaviors of residents? How does the ministry intend to address the first target group, who are the senior residents above 60, who may be even more rigid in their mindsets and their behaviors? Why is there little mention of upstream interventions when one is younger, such as those in schools, because that's when behaviors and mindsets are shaped? Now, surely upstream interventions in schools through proper eating, proper exercising, emotional management are an important part of developing good health habits for life. And then for the even more vulnerable, what is the ministry's recommendation for younger Singaporeans who are disabled, who have special needs, and who are prone to earlier onset of chronic illnesses due to a lack of education and care? They are best served by healthcare professionals who are a bit more aware, who are more trained, who are more aware of the conditions, such as, for example, Dr. Chen Si-Ling and her doctors at Happy, H-A-P-P-E-E, Happy Hearts Movement. Who and how does the ministry propose to include this group of residents and to fund doctors like Dr. Chen? So those are the groups that need to be looked at and the details that need to be considered. Thirdly, on activation of community partners, such as the Health Promotion Board, HPB, Agency for Integrated Care, AIC, People's Association, PA, Sports, SG, and NParks. Now, I agree totally with the white paper that patients' social, mental, and physical well-being are best achieved through community assets and services. But my own experience my own lived experience on the ground, trying to coordinate all my well-intended service providers, example for the seniors, my experience is that although different parties are all good community assets with good hearts, many of the efforts are usually not well coordinated and they are not quite motivated sometimes to really work together and sometimes even compete for the same clientele. Situations, example, of elderly residents being repeatedly served, because they are the ones that are more forthcoming, some are underserved or even some not even served. Situations like that are quite common. What would the regional health system player, each in charge of about 1.5 million residents, do differently? How can they improve the situation? How will they, as integrators, better organize ground efforts without losing also the passion and the resources of these precious community partners for a healthier SG? With so many partners and touch points, what would the typical experience of an enrolled resident to Healthier SG or the system or a customer look like in his healthcare journey? Some clarity would be reassuring. And next, lastly, on setting up enablers for Healthier SG. So I find it hard to imagine the size of the beast or the initiative based on just looking at the white paper. For Singaporeans to appreciate the big shift and the need for greater investments, I think Minister just announced it's $1 billion for startup and I think $400 million for recurring costs. Now, to justify that, I seek more clarity on the following levers. One, on human resources. What are the types of jobs in detail? What are the skills prerequisites and the number of persons required to realize the vision of Healthier SG? On technology, beyond the one-time grant to assist clinics, if they do convert to an appropriate IT system, how would the maintenance and upgrade costs be treated? What would be needed to facilitate also residents, as Dr. Tan just mentioned, to facilitate residents who are not tech-savvy to use apps like Healthy 365, so that this group indeed is not left behind. On performance indicators, the selection of performance indicators, whether process or outcome indicators, whether lagging or historical or leading indicators, this selection is never an easy task, even in the world of management and usual management and leadership. What gets measured gets done, as they say, but what gets measured and paid for gets done even more. Badly selected measures lead to unintended bad consequences. Resident enrollment rate or health plan completion rates can easily be ramped up through aggressive marketing without regard for quality or follow-up. So I urge a further scrutiny and discussion on the white paper's proposed key indicators. In conclusion, sir, I highly support the intent of the Healthier SG white paper. Many countries have done it, developed countries, many have tried with different varying degrees of success. Now, I've raised issues and concerns from my own lived experiences, trying to coordinate ground efforts, and from those who are serving in healthcare and the community. I hope the ministry will seriously consider my inputs. A transformation of this nature is complicated. But I believe that if any country can succeed in nurturing a healthier people, Singapore would be the one. Sir, I support the white paper.